Hi, I'm Dr. Rashmi Yogish, Consultant Fertility Specialist at Khushi Fertility IVF Center, Bangalore. When to do a urine pregnancy test or take a pregnancy check? This is something which is very tricky, especially because the pregnancy test shows up with a positive report depending on the level of the beta HCG, and surprisingly, the beta HCG level is different for different women and different pregnancies. It could be high in the same woman in one particular pregnancy and could be low in the same woman in another pregnancy. And that's why there's no fixed timeline as to when a urine pregnancy test has to be done. But however, doing the urine pregnancy test at least 10 days post ovulation gives insight about a pregnancy being there or not. What we usually do is that if the lady is very sure about her ovulation date, if she's tracked it with a LH kit or if she's gone through a follicular monitoring and she knows that yes, this was the date of ovulation, then doing a urine pregnancy test as early as 10 days post the ovulation will tell her if she has conceived. However, sometimes there could be a possibility of another follicle which was subdominant, which can rupture later on, and therefore there could be a possibility of a pregnancy happening thereafter too. Therefore, a negative pregnancy test on the 10th day post ovulation does not negate pregnancy completely. One has to repeat the urine pregnancy test post 15 days to be very sure about a pregnancy not being there. And most of the times, if a pregnancy is not there post 2 weeks of ovulation, women generally get their periods until and unless they are on progesterone suppositories or tablets that help to support the pregnancy and also postpone the period. The moment the progesterone medications are stopped, within 4 to 5 days, most of the women get their periods. Very few women take up to 10 days post stopping the progesterone tablets to get their periods. And therefore, until and unless the periods resume, the lady has to keep doing the urine pregnancy test once in every 5 days. And if 2 occasions of urine pregnancy test turn negative, that is 10th day post ovulation and 15th day post ovulation, if the pregnancy test is negative, I would recommend the lady to do a beta HCG blood test 20 days post ovulation to be very sure that there is no pregnancy. In case there is a pregnancy detected post 20 days, it is time that she goes and sees an obstetrician or a gynecologist to be very sure about how her pregnancy is progressing. Some women have the beta HCG levels that are quite low. This could be either due to pregnancy that is not in the uterus but in the tube, and sometimes it is because of a pregnancy which is not very strong enough. This could be because of the embryo not being normal or the embryo being normal and the uterus not supporting the pregnancy. In such cases, if the beta HCG levels are low, this is more alarming and the lady's visit to the obstetrician should happen as early as possible in such cases. However, in cases of intrauterine insemination, if the lady has not got her periods 2 weeks post the beta HCG being negative, in such cases, she has to go and visit an obstetrician. We usually ask the lady to do the beta HCG blood test exactly 2 weeks post ovulation, be it a natural try or after an IUI. However, 2 weeks post the natural try ovulation cycle period or after 2 weeks of an intrauterine insemination, which is obviously done post ovulation, if the beta HCG is negative, she should be getting her periods about 20 days post the ovulation. However, if the lady doesn't get her periods even 2 weeks post a beta HCG negative report, that is about 4 weeks post ovulation, it is time that she goes and consults the obstetrician gynecologist and gets a pelvic scan done. We have seen that women who develop huge retention cysts or corpus luteal cysts sometimes don't get their periods even after 4 weeks of the ovulation. Such women would need an additional progesterone support to get their periods. However, understanding that pregnancy test is not just a urine pregnancy test but supplemented by a blood test called as beta HCG is a very important information for all women to know. That's because sometimes the urine pregnancy test kits could not give the right information, especially if the urine pregnancy test kit is not within the recommended period of usage after its manufacture. We've seen that most of the times in pharmacies, the urine pregnancy test kits are kept in the open. It is a very surprising thing to know that if the urine pregnancy test kits are exposed to high temperature for a prolonged period of time, they may not be very sensitive, and therefore sometimes positive pregnancies can get missed. Especially in summer, we see that a lot of urine pregnancy test kits don't show up a positive report even when the pregnancy is present. In such cases, it's very important that one becomes vigilant about the urine pregnancy test kit not being reliable in situations like this, and think about doing a blood test called a serum beta HCG. The serum beta HCG typically can be done at any time of the day, unlike a urine pregnancy test which should be done in the early morning hours and the first 1 or 2 urine samples, as the HCG concentration in the urine is maximum in the morning hours. The beta HCG test does not even need any fasting status and can be done irrespective of when the lady has had her food. And the beta HCG blood test is something which can be done in any laboratory, and therefore it can be a very important test to detect pregnancy apart from the generally done urine pregnancy test. The most important thing for women to know is that the serum beta HCG doesn't really need the recommendation of a gynecologist, and a lady can just walk into any clinical laboratory and ask for the serum beta HCG blood test herself. And therefore, urine pregnancy test supplemented by serum beta HCG 2 weeks post ovulation is the apt time to test for pregnancy. The earliest time to test for a pregnancy would be 10 days post ovulation. Nevertheless, the 10th day mark is not very sensitive, and it's always ideal to wait for 2 weeks post ovulation to take a urine pregnancy test or a beta HCG blood test.